Once upon a time, deep within the shelves of veterinary clinics, there sat an unassuming drug called Fenbendazole. It was used for deworming pets, dogs, cats, livestock, but certainly not humans. At least not officially. Then came whispers. Online forums, anecdotal blogs, and underground communities began murmuring about cancer patients using this anti-parasitic drug, and somehow walking away with miraculous results. For years, science was skeptical. But now, a new case series brings those whispers into the medical spotlight. 3 people, one unlikely ally. An 83-year-old woman was diagnosed with aggressive stage IV breast cancer, spreading through her liver, lungs, and bones. Conventional options were limited, so she added FBZ, just 222 milligrams a day, to her regimen of hormone therapy, vitamins, and a bit of targeted radiation. 8 months later, her tumor markers vanished. PET scans showed no signs of disease. Nearly 3 years later, she's still cancer-free. No chemo, no side effects. A 75-year-old man with metastatic prostate cancer had tumors in his spine, pelvis, and lymph nodes. Alongside traditional hormone therapy, he began taking FBZ, ramping up to 444 milligrams daily, and mixed in natural supplements like curcumin, berberine, and melatonin. The results? His PSA stayed undetectable for over 2 years, and his scans showed regression of the metastases. He's living in a near-complete remission. The third patient, a 63-year-old man with advanced melanoma, also had a second cancer, ureteral carcinoma. With limited treatment options, he started taking FBZ, 222, 444 mg a day, and a handful of supplements. Later, he received just 2 doses of nivolumab, an immune therapy. The outcome? His circulating tumor DNA dropped to 0 in under 2 months, and scans showed no trace of cancer. 11 months later, still no relapse. But how could a pet dewormer do this? Scientists have long known that fenbendazole isn't just for worms. It does 5 big things to cancer cells in lab studies. Stops cell division by jamming up their internal scaffolding, microtubules. Activates p53, the guardian gene that kills off damaged cells. Blocks proteasomes, which tumors use to clean up waste proteins. Starves tumors by cutting off glucose and glutamine uptake. Stops new blood vessels from feeding the tumor. And perhaps most importantly, may disable cancer stem cells, which are notorious for causing relapses. While the results are stunning, the authors, and the patients themselves, acknowledge serious caveats. All 3 patients self-medicated, meaning there were no controlled dosages or oversight. They also took other treatments at the same time, including hormone blockers and immunotherapy. Spontaneous remission, though incredibly rare, can't be ruled out. Still, the patterns are hard to ignore. 3 late-stage patients, 3 remarkable recoveries, no chemotherapy, and 1 common denominator, fenbendazole. The authors conclude with a plea: rigorous human clinical trials must begin now. Fenbendazole is cheap, safe in animals, and already available. But without proper testing, its true potential or dangers remain a mystery. In the words of those watching from the sidelines, this is either the beginning of a revolution or a spark that fades. Only science can decide.